We are closer to Medicare for all than ever before. So, of course, the right wing is coming out with their lies that, oh, my God, it's going to bankrupt seniors if that happens. Check this out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. Rick in Rotunda, West Florida, says you disagree with me. About what?
Hi, Tom. How you doing? You had mentioned Medicare and additional people getting added to the Medicare rolls, lowering the age, etc. I'm down in Florida, and one of the big concerns is in our Social Security every month, they deduct a Medicare contribution. It's $148 a month, and that helps support the Medicare system. And when I retired in 2012, that was $110 they were taking out of me. Now they're taking $148. People down here are really concerned that, first of all, we feel that the Medicare system is almost bankrupt anyway. And if we start adding additional folks on this program, we lower the age, whatever it is, that contribution is going to triple because the program is not a solvent type of program. And that comes out of our Social Security. And that's the big concern here, that it's going to be $500
Rick,
a month.
Yeah, I get it. And I know that that's been the propaganda coming out of organizations like FreedomWorks. I don't know if they've specifically said that, but I've read, numerous websites and had gotten emails from right-wing sources saying, Medicare for all is going to wipe out seniors. It's a lie. Rick, it's a lie. You really have nothing to worry about. First of all, if Medicare is extended to everybody in the country, right now, the federal government over the last 20 years or so has actually reduced Medicare benefits for seniors. The copays have been going up, the drug prices are going up, all kinds of things are going up. Medicare is actually getting more expensive over time, as you point out. Seniors are not a large enough voting bloc, and they don't vote Medicare rabidly enough that there are politicians who are terrified of Medicare voters. In fact, there's not even really a Medicare voting bloc. There's a Social Security voting bloc, but not so much for Medicare. If everybody in the country is covered by Medicare, you can bet your bottom dollar that just like literally every other developed country in the world, and probably a third of the developing countries in the world, that program is going to get up to snuff. There is not, talk to Canadians, talk to Germans, talk to French people, talk to the Brits, talk to Swedes or Norwegians, talk to Italians or even the Greeks who have serious problems with their system. None of them are willing to go to the kind of system America has, where the average family is paying between $4,000 and $6,000 a year more for medical services than in any other developed country in the world. So number one, if everybody goes on Medicare, we're going to save about $1 trillion a year, certainly at least $800 billion a year that we can document that is being sucked out of the system by health insurance executives, dividend payments to the insurance companies, fraud and waste, all the thousands, the hundreds of thousands of people who are, quote, claims processing, when in fact what they're doing is looking for excuses to say no and all that kind of stuff. We've got a giant bloodsucker attached to our back in the form of the for-profit health insurance industry. And they will tell any kind of lie to keep those billions of dollars flowing to them. I mean, United Healthcare, one of their CEOs made $1.6 billion. Dollar Bill McGuire, they called him. If we were to extend Medicare to everybody, number one, you've got a huge pool. That's every person in the country paying into it. In Canada, it's about $140 a month. Every family pays, period, right across the board. And that gives you everything and no deductibles, right? And pretty good coverage on pretty much everything. And, different countries do it in different ways, and different provinces, actually, in Canada do it in different ways. But you will see a voting bloc that politicians will be terrified of when everybody has access to Medicare. And then, for the rich people who are sending out the emails and posting the stuff on Facebook saying, hey, if you're old, be afraid, join us in fighting Medicare, expansion. For those people, just like in other developed countries, there will be health insurance companies that will come along and say, okay, rich person, give us $25,000, $30,000 a year, and we'll give you a health insurance policy that guarantees that you get your private room in the hospital when you go in, that will fly you on a private jet to the best facilities in the country, that will bring you into the country when you're outside the country, that will give you all the amenities that Medicare doesn't. It'll be a supplementary program that'll be available for very wealthy people. And, this is how it works in every other country. So, Rick, take a breath. It's going to be okay.
Yeah, well, I hope you're right. But thanks for the time, Tom.
Yeah, you're welcome, Rick. The way I know I'm right is this is how it works in every other developed country in the world. Literally not one of them. You do not hear Germans saying, we want the American healthcare system. You don't hear Canadians saying, oh, we want to get rid of our Medicare. Never.